Hi everyone, my name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today I want to talk to you about the exciting world of NAD. So NAD and its related therapies have become very popularized in recent years by people like David Sinclair, and there are a lot of big claims around it. So it is being touted as one of the best known things for reversing the biological clock, therefore making you and your cells younger. So today I want to walk you through what NAD is and what are the potential benefits that we actually see and how is it being used in medicine today. So let's start out by defining and letting you know what NAD is. NAD stands for nicotinamide adenine dinucleotide, and this is a powerful coenzyme used in every single cell inside of our body. Now, when I say coenzyme, I mean it is something that makes enzymes, which are things necessary for reactions in the body to happen, work better. So as a coenzyme, it is used a ton in energy producing pathways, DNA repairing pathways, genetic expression pathways, so how we turn genes on and off. And so these are some of the reasons why it is being seen as an anti-aging molecule. Because theoretically, if we can repair our damaged DNA, for example, better, then we're going to reverse some of the damage that we accrue as we age and therefore youthify us. Now that is a very oversimplified example, but roughly speaking, that is what NAD does. Now our body has the capacity to make its own NAD, recycle its own NAD, and if it's going to make its own, it's through things like an amino acid called tryptophan and B3 derivatives. And now a lot of these B3 derivatives are really what are being claimed as helpful for NAD boosting when we look at different types of supplements. For example, we have things like nicotinic acid, we have nicotinamide, we have nicotinamide riboside, we have nicotinamide mononucleotide. Now I will define for you what those are a little bit later, which ones are actually being used in supplements. But for now, just know that roughly speaking, we can make our own NAD, and that is what a lot of these NAD boosting supplements are trying to accomplish. They're trying to give you the precursors necessary to build more NAD inside of your body. Now, just because NAD is technically inside every cell inside of your body, it does have higher concentrations in different tissues. So NAD is primarily found inside of our mitochondria, which are the part of our cells that make energy. In fact, I did a whole episode dedicated to the mitochondria and how it boosts energy, so I'll link that below. But nonetheless, NAD is mostly found inside of those mitochondria. So tissues that have more mitochondria are going to be more heavily impacted by varying NAD levels. The best examples of this are things like the heart, the brain, and the muscles. They do tend to be the most dense in mitochondria, and they are the most energy hungry organs. And I mean, it makes sense, right? Like the heart pumps a ton of blood every single minute to keep us alive. Our brain is processing everything, dictating whether or not we move our muscles. It's very important for regulating everything inside of the body. And in fact, the brain, despite the fact that it only takes up about 2% of our body mass, it actually consumes approximately 20% of our total energy in a day. So that is a really good example of just an organ that needs a ton of energy to work well. And that is why things like the heart, muscles, and brain tend to feel it the most when we get declining levels of NAD. To put this into even more context, the heart, for example, roughly has about 90 micrograms of NADH per gram of tissue. The brain and muscle has about roughly 50 micrograms per gram of tissue. And a red blood cell, for example, has about 5. So there is a huge discrepancy here. And this is really why those are the areas that I'm going to focus on when I go over the benefits. But before I go over the benefits, I need to describe to you why we deplete NAD with age, because it is very well known that as we age, our NAD will go lower and our mitochondrial function will go lower. And for certain individuals, this may happen quicker than others. So let's talk a little bit more about what's depleting your NAD inside of your body. When I think about why NAD is depleting in the body, I like to break it down into 3 different categories. First is, are you consuming enough of the NAD precursors? So this is really where we dive into things like diet or supplements to kind of help boost B3 derivatives and to boost our amino acids and all the things that help produce more NAD inside of the body. The second thing you want to think about is your body consuming a lot of NAD? So as I mentioned earlier, NAD is used a lot in DNA repair. So if we're constantly exposing ourselves to toxins and radiation and UV and all of these things that damage our DNA, we're going to need more NAD to counteract that, to go in and repair. So for example, one of the enzymes used for DNA repair called PARP can use up to 30% of our NAD pools. So this is just to highlight that sometimes it's not so much that you're not getting enough in the diet, it's more that you're over consuming it because of things you're putting your body through. And then the third thing is, how well are we recycling that NAD? So when the NAD is used in these reactions to repair DNA, it will have to get recycled so that you can use that again. And most of our NAD is actually recycled NAD. It'd be terribly inefficient if we had it any other way. We would have to consume so many of these NAD precursors that it just wouldn't make a lot of sense. So things that also impair our ability to recycle NAD are also going to play a big role. And one thing that they found that will impair one of those enzymes that help you recycle NAD is overconsumption of food, so excess calorie intake, and obesity. Now, these are definitely not the only 2 things, but it's an example of a lifestyle where you are dampening your ability to recycle your NAD, therefore your reserves of NAD are going down. So you really do want to think about it from many different angles. So with that in mind, I just want to leave you with a couple takeaways on different things you can focus on in order to prevent the loss of NAD. So as I was kind of getting at earlier, preventing as much exposure to things that damage your DNA as possible. So this will be things like UV, radiation, certain medications. There are toxins that we expose ourselves to. There can definitely be certain chemicals in our cleaners, in some of our beauty products. All of these different things can damage DNA, and they're going to put a higher burden on that NAD pool. The other thing would be not over consuming calories, decreasing alcohol use. So NAD is very much used in that pathway to kind of detox and get rid of the alcohol out of the system. Taking care of chronic infections. So pathogenic infections will activate immune systems that really consume a ton of NAD. And so yes, for sure, preventing getting colds and flus and things like that can be helpful. But I'm talking about some of these more chronic issues where people have things like chronic Lyme or mold or some of these larger infections that burden the body over a long period of time. Inflammatory conditions, so inflammation inside of the body will create a ton of damage, and NAD is very much involved in cleaning up those damages. And so these are just some different things that you can kind of look at inside of your own life and think, okay, I could probably clean up some of the chemicals I'm using. I could probably not expose myself to as many pesticides. There are some things that you can modify in your life that will help prevent the loss of NAD and help you stay younger for longer, theoretically. All right, so now that we've talked a little bit about what's causing you to lose NAD as we age, let's talk about some of the benefits. Because it's important to understand that although NAD is being used all throughout the body, that does not mean it is a cure-all. It does not mean that it can be used to help every single illness or ailment that you might have. As I kind of got at earlier, there are certain organs that use a lot of energy, and those tend to be the ones that are most impacted by NAD boosting therapies. So let's start by talking about the most energy demanding of all of the organs, the heart. Now, for any of you who have ever had an NAD IV, and certainly a higher dose NAD IV, there is almost no denying that it has an impact on the heart. Because if you drip that IV too quickly, people will get sensations inside of the chest cavity. And this is because the NAD is flooding the cells of the heart and flooding the mitochondria really quickly, leading to an almost excess of mitochondrial activity as it's ramping things up. So, unsurprisingly, they have found that depleting NAD levels has a negative impact on our heart muscle. And this can contribute to worsening outcomes when it comes to heart failure, which is essentially a decline in the function of your heart. It can't pump efficiently anymore. And so they've looked at this and they have found that some of these NAD precursors can actually help improve the inflammation of the heart tissue and the function. Now, it's not super clear based on the studies that we have whether or not NAD therapies can help reverse any of that heart failure, but it certainly looks like it can be helpful for preventing further breakdown of the tissue and further damage. Now, if we take a little bit of a broader look at the cardiovascular system, we do notice that there is some beneficial impact on the blood vessel walls. There is a decreased infiltration of immune cells into the blood vessel walls and less breakdown of those blood vessel walls. Now, this is relevant when it comes to things like aneurysms, and that's what they studied. So an aneurysm is basically like a ballooning of the wall. So you have these blood vessels that essentially are like tubes, and you'll get like an outpouching of weakened wall that is at a high risk of popping, and that is going to cause something like a stroke. And they studied these in animal models, and they found that NAD therapy helped prevent those aneurysms from forming because you weren't getting the breakdown of the wall because there was less inflammation inside of those walls. So this is another area that is really cool when it comes to NAD therapy. And the last thing I want to say on this is they also found that there can be an improved circulation associated with NAD. They found that you were more likely to form new blood vessels. So a lot of the times we damage our blood vessels and our circulation can't bounce back. And so NAD seems to help that circulation bounce back. Now, that's my general understanding of how NAD is actually being seen to help inside of the cardiovascular system. I'm sure the benefits will keep coming out as they study this, but at least for now, those are the areas that seem to have the strongest amount of research behind them. Now let's talk about another really cool organ, the brain. When it comes to brain health, one of the biggest areas of use for NAD is in the addiction realm, which is super interesting. So what they have found with addictions and people who have had addictions for a long period of time to various different types of substances, food, things like that, is there is a mitochondrial decline inside of the brain. That's at least one of the things they found. And associated with that, there will be increased inflammation, oxidative stress, poor blood flow to certain areas of the brain. And so NAD is being used to help promote mitochondrial activity inside of the brain, improve the production of certain neurochemicals. And what they have found in studies is it actually works, which is super, super cool. What they have found in these human studies is that high dosing NAD, so they were using NAD IVs in higher doses every single day for about 8 days. They found that there was decreased cravings for the substance, decreased anxiety, and down the line, less chance of relapse. Now, in my very limited experience in clinic, I have found these IVs to be helpful for addiction. Certainly the cravings aspect, but nonetheless, the difference with addictions versus some of these other uses of NAD is you do typically need to dose it quite a bit higher. And that's what I've noticed in my clinical practice, and what I've noticed is used a lot more in other people's clinical practices. So that's just a little caveat. It's really helpful for addictions, but you do kind of need to dose it quite high because the brain needs a lot more, assuming it was more depleted through the substance addiction. The other area of use for NAD therapies that is getting a lot more traction is for neurodegenerative conditions. So these are things like Alzheimer's and Parkinson's. Now, the Parkinson's studies, while they are few, are quite promising, and some of them have seen up to 80% improvement in people's disabilities. Now, I will admit the research I looked at in regards to Alzheimer's wasn't quite as impressive. I think it would likely be a more helpful thing preventatively, but then when you give it to people who already have full-on Alzheimer's, the benefits don't seem to be that drastic and that dramatic. But either way, it is being used that way. It does have potential. It seems to perform a little bit better when it comes to things like Parkinson's and addictions. And certainly I've noticed it in some of my populations for more generalized mood balancing. Probably the most common area I see it being used is for burnout. So this is when people have become highly stressed over long periods of time, and it's resulting in a lot of things like brain fog, poor concentration, extreme fatigue. And the NAD therapies that I have given and through the research has been very promising for things like burnout. I've even used it personally for burnout and noticed a pretty big difference. Now, of course, like anything, it's not a guarantee you're going to notice a difference. If you're tired, it can be due to a lot of different things. But if it's a fairly obvious burnout picture, NAD therapies can be quite helpful. All right, so now let's talk about how NAD therapy could be useful when it comes to improving the function of your muscles or your exercise capacity. Now, as I kind of mentioned earlier, the NAD therapy can potentially be helpful for improving circulation. And that in of itself is going to help with things like endurance. If you can deliver more oxygen and more nutrients to those tissues, to those muscles, theoretically, they will work better for longer. Now, what I notice clinically is the changes to, say, endurance and exercise capacity are often quite subtle. So don't expect this to be like a pre-workout that's going to jack you right up or any sort of life-changing therapy. But for people who are more competitive in their sport of choice or who are just much more in tune with their body, they're tracking things a little bit closer, they often will notice a difference. Now, when they study this, they have found that it can be helpful for things like how fatigued you get during exercise, so helping prolong the period before you get fatigued. But the catch is, when they looked at least this one particular study, this benefit was only really seen in older individuals, which makes sense. As we age, our NAD declines. And so the differences with someone who is older, theoretically, who has lower amounts of NAD, should be more dramatic. So they have noticed differences in the studies. It does lend itself more to an older population. Not to say you couldn't likely use it as a younger individual, but the changes are probably going to be a lot more subtle, and you might not notice that it's worth the expensive price tag that is associated with a lot of these therapies if that's the only reason that you're using it. Now, do keep in mind, those are not the only uses of NAD. There is, as you will surely see if you do a quick Google search, a lot of claims around NAD. I just wanted to focus on some of the areas where I have clinically noticed a bigger difference with my patients and where there is a little bit more backing in the research. Hopefully they find that it can be used for a lot more than that. And I'm sure some of you will comment below that it is useful for a lot more than that. But these are just some of the highlight points. Now, before we wrap up, I did want to talk about what these different NAD boosting therapies are. Now, I'm going to focus a little bit more on some of these supplements and the IV, but just know that you can boost NAD inside of the body more naturally. So, for example, they have studied when you do things that put you in more of an energy deficit, so things like fasting, calorie restriction, exercise, those can have a boost in your NAD levels as kind of a reflex to you draining them. And so just know that there's other ways to promote NAD production inside of the body that don't involve purchasing something off of a shelf or going to visit a doctor for an IV. But those are the things that I'm going to just briefly touch on because those are probably the more common things being used to boost NAD outside in the market. The three things that I have found have the best literature behind it and are definitely the more common products out there are things like NR, so nicotinamide riboside, NMN, which is nicotinamide mononucleotide, or just an NAD IV, which can be given as a standalone or in combination with other nutrients like a Myers cocktail. So when it comes to NR, they have found that this absorbs better than, say, if you were to try and give NAD normally as it is as a supplement. And the same with NMN. And they have found that NR and NMN both will absorb and get incorporated into tissues. Now, if you take a look at the two main supplements, NMN and NR, there's a lot of debate online on which one is better versus the other. The literature does seem to lend itself more to NMN, so more effective at a lower dose. But theoretically, if you look at the mechanisms, NMN is a larger molecule, therefore theoretically a little harder to absorb. I'd say both have been shown to be clinically effective, so you don't have to get super nuanced about it. But if we were looking at the nuanced details, the differences between the studies, NMN does tend to be the preferred form, and that is the form that you're going to find in some of the David Sinclair products, which he is kind of one of the NAD gurus out there. So a little bit more of a trusted source. But either way, both seem to be effective as long as you're taking a high enough dose for the right reasons. Now, if we look at NAD IVs, there is even more controversy because a lot of people believe that NAD intravenously can absorb into tissues because they haven't found specific receptors that are able to do that. Now, I'd like to caveat one thing. It is extremely hard to study receptors. So it's not like we know every single receptor inside of the body, in and out. They're extremely hard things to study. And when you look at studies that use the application of NAD IVs, that's really a lot more promising because when they studied it, they have found that up to 2 hours into that drip, your NAD levels inside of your blood and inside of your urine do not go up. So this suggests that the NAD is being driven into tissues. They have found a couple receptors on things like the heart and the brain that likely are taking that in at least those tissues, but likely many others. It's just beyond the 2 hour drip point where they started to notice the rise of NAD inside of the blood. So theoretically suggesting that your tissues have kind of saturated at that point. They've taken up all that they can take up at the moment. And so any dripping of the IV beyond that could potentially go to waste. And this is really how I like to use it clinically, is I do dose it a little bit lower. Average doses are somewhere between 100 to 500 milligrams per IV. And again, whether they combine nutrients in there, that's a different topic for a different time. But the dosing, the mega dosing of these IVs, you're going to feel tremendously bad doing that because, as I suggested earlier, it causes a ramp up of that mitochondrial activity. So it can give you really gross symptoms while you're getting the IV itself. So that can be chest tightness or discomfort, stomach aches, things like that. And so this is why I kind of shy away from these mega doses, certainly outside of the context of addictions where maybe it is a little bit more necessary. But if you're just doing an NAD IV for a burnout, you do not need a gram of NAD, or at least that's my clinical opinion. And when you look at the studies, it doesn't really seem to absorb that well past a certain dose. And if you're doing things like a gram, that person is sitting in that IV chair for upwards of 4 hours. And so theoretically, for 2 of those hours, they're not really fully absorbing that. And those are the research items that I found out there. Please comment below if you found that certain forms tend to work a little bit better for certain conditions. I'm always up to being a little bit more educated, and you guys always comment really great things. So thank you guys again for listening. I really hoped this helped clarify some things for you. I hope you learned a little bit today. And if there are any other topics or any comment that you want to leave below, please do so. Thank you so much for listening and have a great day.